At the Experimental Biology Meeting 2022, members from 5 societies gather in Philadelphia to discuss new developments in research in anatomy, biochemistry and molecular biology, investigative pathology, pharmacology, and physiology. The EB Meeting program features plenary lectures, workshops, symposia, networking opportunities, and much more. And EBTV is right here bringing you all the latest from the meeting. Welcome to the Pennsylvania Convention Center in Philadelphia and episode 1 of EBTV 2022. As attendees are joining for the first day of the program, we speak to some of the societies involved to find out the latest in their area of expertise. We catch up with the ASIP president to hear more about the society's plans for the next year. We also learn about the threat of foreign influence on research from a thought-provoking APS session. We hear more about research developments from organizations around the world, find out more about the Anatomy Scholars Program, and attend the master class on the pelvis, perineum, and pelvic health. As you can see, we have an exciting program coming up, so stay tuned for our first interview. You're watching EBTV. I'm here with ASIP President Pat D'Amore. Thank you so much for joining us in the EBTV studio. So this is the first in-person meeting since 2019. How does it feel?
I'd say everybody's ecstatic to be in person. So the energy is just really so much sort of more robust than usual. People are always happy to come together and speak science, but this is like a whole new level of excitement. So people are really happy to be together.
What are some of the highlights for you for this meeting?
Highlights for me are that our organization, it's American Society for Investigative Pathology, we have several foci, but one of them is a lot on trainees. So we have lots of programs for trainees, postdocs, so people have finished their PhDs and are maybe on their way to a academic position, or somebody may be going into a company. So we have a lot of career development, helping them figure out what their next step is, how to manage people, how to set up a lab. So we have a big focus on trainees. And then on the other side of it, as even though our title is American Society of Investigative Pathology, most of us are actually PhD researchers, some MD PhDs. We're very interested in disease processes, so understanding how diseases develop. So we have many sessions: liver, breast cancer, brain pathology, Alzheimer's, vascular pathology. So lots to choose from. And since we haven't been together, there's a lot of new things that have happened in the meantime that we haven't gotten to talk about.
Tell me about the focus moving forward and what the society is going to be doing this year into next year.
Well, for us, it's actually pretty interesting because I already spoke about the pathology piece. We're very interested in having people understand that even though pathology is in our title, and a lot of people would think, well, autopsies or reading slides from somebody's biopsy. There's a piece of that, but there are separate organizations for that. We're really in the trenches trying to figure out how diseases develop, because if you can figure out how a disease develops, you're actually in a position to interfere, find a disease target, treat it, maybe even figure out how to prevent it from happening. So we're interested in having people understand that, and in fact, most people who do research are interested in some sort of disease development. Mm-hmm. So we want people to understand that as a pathology organization, we're very inclusive, and we want people to understand that we're a good place to come to meet colleagues and learn about disease processes with a translational aspect. We all want to translate our research to the bedside, see people benefit from our research.
Sounds like a lot of really interesting things going on. Well, thank you so much for your time. Thanks for visiting us here in EBTV.
Pleasure to be here.
And have a wonderful rest of the time here at the meeting.
Oh, I plan on it. Thanks.
Next up, we're attending the APS session on understanding the threat of foreign influence on research. Let's find out more from the session organizer and speaker.
So the issue of foreign influence and unfair foreign influence on our research has been ramping up over years. The issue is some countries are really trying to get us to divert our science to them unfairly to give them an advantage of use of American tax dollars.
This session is about research integrity and research security. And these are things that in our areas of research, we never thought we had to think about. Of course, the way you do research is according to the principles and the rules that we all know well. You want to be transparent, you want to be objective, you want to be fair. Unfortunately, we're seeing incidents where researchers are being influenced by other governments, and that's really hard for us to believe in our areas, but it's a risk that we have to be aware of. Of course, we can't control other governments, but what we can do is think about how we can practice research and be aware of the risks so that we continue our open research system.
There was a presidential memorandum that was issued in January that indicated that many new rules are coming. And two of our speakers are from federal funding agencies, the National Science Foundation and National Institutes of Health, and they're going to give us some of the expectations that they have about new requirements for people to get federal grant dollars. So it's very timely to give scientists some feedback about what they should expect in terms of what they're going to have to do in the future.
What we want to do in this session is talk about what some of these risks are, talk about what to do if you're encountering these risks, and then the difference between what I'm talking about in research security and research collaboration, international collaboration, which is different and which is encouraged.
It's mainly for scientists who will be having to comply with new rules. It's also meant for administrators and people involved in research administration because they're very interested in what's coming and what they're going to have to implement at their institutions.
We all have a shared responsibility to preserve the integrity of our research, and so that's who we want to focus this session on.
We're going to start off with some background on how this whole foreign engagement concern evolved over time, and then the representatives from the funding agencies will come in and talk about what they're doing.
I hope that they see that international collaboration is definitely encouraged. What I worry about is that I hear those in the community, they're afraid to enter into collaboration because they don't know where the line is. So I want to help them with what that line is and differentiate between principled international collaboration and risks in research security.
Now let's take a look at some of the latest developments in research, from drug discovery to cancer research to chemical genomics. The University of Pittsburgh Drug Discovery Institute wants to make sure that the right drug gets to the right patient at the right time. Translational science is a key part of this mission. Let's take a closer look.
The future of life sciences in medicine is precision medicine, getting the right drug to the right patient at the right time. We are not just interested in making academic discoveries, publishing papers and reviews. We want to make sure that our work is brought to the public.
Our vision has been to move away from this type of one drug, one target, one disease formalism.
Starting with the input of patient-derived genomic information, we're able to use that information and identify drugs that would alleviate disease-specific phenotypes.
A key strength here in Pittsburgh is the commitment to bring our basic science and clinical science and engineering and computer science to life.
This year, the Salk Cancer Center is celebrating its 50th anniversary by breaking new ground in cancer metabolism research. We visited the beautiful San Diego institution to understand more behind the relationship between the immune system and cancer.
This is a particularly exciting time in cancer research.
The field of cancer research has undergone two major revolutions in the past decade. The first is in cancer genetics. The second is in cancer immunology.
As we've gained an appreciation for the role of the immune system in keeping tumors in check, now we have to consider the effect of metabolic interventions on both the cancer cells and the immune system.
Salk is a hotbed for metabolic research in cancer.
Over the past 10 years, we have really recruited in people with very deep expertise in complementary areas of metabolic research. The momentum we have is unparalleled. This is the time for conquering cancer and for conquering cancer at the Salk Institute.
The U.S. Army is developing new solutions for a changing combat environment. Soldiers are practicing cutting-edge techniques and using the very latest tools to extend trauma care on the battlefield. Let's find out more.
Here at ISR, our mission is optimizing combat casualty care. So everything we do here focuses on taking care of the wounded soldier.
As the Army has pivoted its focus to shift to prepare for large-scale combat operations in a multi-domain operating environment, there's a recognition by the ISR and other medical leaders that the rapid evacuation times and low casualty rates of those recent wars will no longer be able to be replicated in the future combat environment.
What we are going to do over the next 10 to 15 years is harness modern biology to solve fundamental problems and completely transform trauma medicine in a way that hasn't occurred really ever.
We're EBTV, your daily news show featuring interviews and discussions from this year's EB meeting in Philadelphia. You can catch us around the convention center, in your hotel room, or on the EB website and on YouTube. And you can join the conversation on social media. With new content each day of the meeting, make sure to keep watching. I'm joined by Lloydie Jerome Majewska with the American Association for Anatomy, and she is here to talk about the Anatomy Scholars Program. Tell us a little bit about the program and who it's for.
Sure. So this is the first year of the Anatomy Scholars Program. The goal of the Anatomy Scholars Program is to help in the retention and promotion of folks that are underrepresented minorities within academia. And so the program was established or was proposed to the association in 2020. With full support, we developed a curriculum and are now launching as of yesterday.
Why did they feel like it was so important to have something like this?
So the reason that this program came about is that we were reflecting on the fact that after 40 years of all kinds of programs to try and increase the number of folks that belongs to underrepresented groups in academia, there weren't that many. And so when we look at the numbers, there's been a large number of students that are now in the undergraduate programs and graduate programs, and yet when those people are promoted to academia as assistant professors, they are exiting. And so we wanted to try and change that and make it so that they can stay and become full professors and part of the academia. So if I were to give you some examples of numbers, if we look at the proportion of full professors that are Black women, like myself, it's about 3% for the past 40
3%?
3%. And that's been the case for the past 40 years.
Oh.
Although there's all of these things that's been done. And so if you look at the proportion of the population, of course, I don't have to tell anybody that it's much larger than 3%. And the numbers are worse for other groups. For example, indigenous people or people who are Native Americans, as they're called here, is less than 1%. That doesn't make sense. So we're hoping to change that.
Tell me a little bit about how the scholars will be supported.
Sure. So the Anatomy, the American Association for Anatomy, the AAA, has basically guaranteed 3 years of funding. And so we have found all of the best people to provide what we call a professional curriculum. And this professional curriculum includes things like making an individualized plan for how they want to proceed through academia, working with the scholars to help them get their funding, to help them become better teachers. But more importantly, what we hope will provide is a peer-to-peer network that will reduce the isolation that those people who do end up in academia face. But in addition to that, we also have a formal mentoring network where there are members of the AAA who have stepped up to help mentor the different scholars to help figure out, so let's say you want to progress in academia in a research track. So we have mentors that will help you to succeed in your research program, get funding. If you want to do teaching, similarly, we have folks who will mentor the scholars and help them progress in that track.
Is the overall goal to kind of change those statistics?
Yes, our goals are clear. The outcome we're looking for is that when we look back in 40 years, there will be a difference, and we'll have people that are closer in proportion to their proportion in the general population within academia.
Thank you so much. It's a pleasure speaking with you.
It was my pleasure.
Now we're taking a closer look at the pelvis, perineum, and pelvic health in AAA's masterclass. Let's take a closer look.
So a masterclass includes a session or a talk about gross anatomy, and then embryology, and then a clinical session. So this masterclass today includes all of those things specific to pelvic anatomy, pelvic development, and then also clinical issues related to pelvic pain and pelvic structures. For our purposes today, we're really looking at including new information about sex versus gender, as well as broadening people's information and awareness related to pelvic health disorders, because generally in clinical situations, it's not something that patients and/or physicians frequently bring up as a course of treatment. We are really geared toward anatomy educators and/or clinical educators, and the idea is to really give a review and update them on sort of current trends, as well as things to incorporate in the classroom and in their clinical teachings. I hope that they leave with a new, wider appreciation of the pelvis and its structures, as well as leaving with a more informed understanding of some of the issues surrounding pelvic pain and pelvic health, as well as sexual health.
That's it for our first day here at the EB 2022 meeting, and things are really beginning to kick off here in Philadelphia. Tomorrow, we'll have more interviews with thought leaders in the field, so make sure to tune in. Before then, you can watch the show here at the Convention Center, in your hotel room, and online. And don't forget to subscribe to EB TV on social media. We'll see you tomorrow.